Welcome everyone to tonight's town hall, where we're going to get to talk about concerns you may have related to COVID and also some tips for a safer summer. So we're looking forward to bringing you some information from our panelists tonight from the Pediatric Health Work Group, the County Office of Education, and Core Investments, the collective of results and evidence-based investments, a collective impact initiative in our county. So we'll get started here in just a moment. We'll give people another minute to finish whatever evening task they were doing and get over to our webinar because people are still arriving. And we're excited to have all of you here. So Celine, I think we can go ahead and go through some Zoom tips. If anyone has not been using Zoom or something similar, you'll see that everybody's muted except for the presenters tonight. And that's just to keep our background noise down. There's a Q&A button that you can see there in your controls. You can click on that and ask questions. We will read the answers out and also compile the answers to send out to you at the end of the webinar. So please feel free to ask questions that way. And we'll also have a chance to discuss some questions at the end of these presentations. If you'd prefer to listen to this presentation in Spanish, click on the globe icon that says interpretation, and you should be able to choose an option to listen in Spanish and listen along and go back and forth if you'd prefer. We'd like to thank Sigilin Ortega for doing the interpretation tonight. We'll make all the copies of these materials available to you afterwards, and we are recording this so that you can share it with others who might have missed listening to it live. Next slide, please. So since we've been open for a little over a week, we're moving in the direction of more open stores, more open places. And as you'll hear from some of our presenters, this is going to be a time where a lot of us are just having to adjust, and that adjustment is easier for some than others. So we thought this would be a great moment to just acknowledge that and talk about some of the questions you may have. So we're going to hear from a variety of members of the Pediatric Health Work Group and these other organizations, as I mentioned. You'll have a chance to hear their ideas about what kinds of stress people are experiencing, and more importantly, what we can do when we experience that kind of stress, and when we might be in a situation where we might need to ask for more help. So all of those will be covered for a variety of different sources of stress and healing. We're also going to hear about some ideas for safe summer activities with kids, with parents, with everybody. We'll also get some updates on the vaccines and your questions about variants. And then we're going to talk about what this all means for returning to school in the fall. We have as our guest, Farah Sabah, the County Superintendent of Schools, who's also a member of the Pediatric Health Work Group. And then, as I mentioned, we'll have a chance to dig through some questions and see what we can answer either now or after the webinar. So welcome, settle in, listen, and please share your questions with us so that we can answer. All righty, with that, I will turn it over to Dr. Francis.
Okay, good evening, everybody. Thank you for taking the time to join us over Zoom tonight. My name is Dr. Devin Francis. I'm a pediatrician, also a parent. I have 3 kids, ages 8, 10, and 12. And the title of our talk tonight is to share your concerns and hear tips for a safer summer. And before we dive into your questions and share some of our tips, I want to just talk a little bit about this unique period that we're in right now. What I've sometimes heard called the no longer and not yet, meaning that we're no longer in this sort of COVID crisis mode. Our infection rates are way down across the country and the state. Our hospitals are not full with COVID patients anymore. Schools are opening up. Summer camps are here. Many of you know that California removed a lot of the COVID restrictions last week, and after more than a year of being in our houses, we're traveling again, we're getting together with friends and family. But at the same time, we are not yet out of the woods with this pandemic. We still have a ways to go to get more people immunized. There's still new COVID variants spreading, and we don't know quite how this fall and winter will look as we open up. So we're really in this transition period of no longer, but not yet. And this is so important because it's a transition, and sometimes transitions are hard. So any of us who have tried to get a young kid to leave the park when they're playing knows that transitions are sometimes hard. Even transitions that we look forward to, like returning to in-person school in the fall, sometimes that can be hard. And children and adults, we don't always display our best behavior during transitions sometimes because of that. And so our very first tip tonight is to just be kind and compassionate with your children and yourself as we all move into this new phase of our lives. Next slide, please. So now we can start to think about, what does re-entry into a more normal life look like? And before we do that, it's really important to acknowledge just how stressful and traumatic this last 15 months have been for all of us. We've all experienced COVID and shelter in place in a lot of different ways. Some of us have been directly affected, maybe being infected or having loved ones infected, or maybe even seeing loved ones pass away. There's been over 40,000 kids in the US who have lost a parent to COVID. So many direct effects. And many of us have also been affected indirectly by school closures, isolation, loss of important milestones like birthdays, proms, graduations. I've seen a lot of kids in my clinic with anxiety, depression. Many kids are coming in with increased weight gain. They're just not exercising as much as they did before COVID. Many kids have experienced a lot of lost academic skills as they and their parents really struggle to adapt to distance learning. So given these high levels of stress over these past 15 months that we've all experienced in one way or another, it's so exciting, and it's such a relief to kind of move back towards more normal activities. For myself, I just spent a week with some of my extended family last week that I hadn't seen them since before COVID. And I even got to meet a new baby nephew who I had never met before. And my kids had so much fun playing with their cousins and grandparents after so long of being told, no, 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 we can't do that. So it's really exciting. And I think we can all really agree that this is just such a great direction to be moving in. And yet with all of that excitement and joy, sometimes it can be stressful, or sometimes there can be anxiety. And I think that's really normal. It's important to recognize that and honor that. And all of us are going to return to life after COVID in sort of a unique way and in a unique pace. But we can all benefit by using these stress-busting tools that we're going to go through to help make this transition in a more calm and happy way. And these stress-busting tools, they're from the California ACEs Aware Initiative, which was developed by Dr. Nadine Burke-Harris. She's a pediatrician, and she's our state's very first Surgeon General. So Dr. Burke-Harris and others, they've dedicated their whole career to studying the effect of trauma on children and how that affects adults' health. And the original studies really looked at what we traditionally think of as trauma: child abuse, child neglect, household dysfunction. And what we have found is the more the children experience these trauma when they're young, the higher risk for things like heart disease, depression, cancer, many other medical conditions. And what happens is that this trauma causes stress that literally changes our bodies and brains and can put us at higher risk for disease. So now more recent studies are showing that other experiences in childhood can also cause the same stress. So things like poverty, racial discrimination, or even a global pandemic like we're in now can cause such high levels of stress that it can impact our health. So one really important thing to remember about ACEs, or adverse childhood experiences, is they're not destiny, it's just a marker of risk. So just because we may have all experienced this very traumatic time of COVID, doesn't mean that we're all going to be negatively affected. And what we want to introduce are these stress-busting tools, because they really can help you lower your stress response and help your children lower their stress response. And that will help us all in our transition back into normal life. So I'm going to turn it over to our work group panel. We'll be talking about healthy relationships, exercise, mindfulness, healthy eating, sleep, and mental health, and all with the goal of kind of reducing stress levels and helping you to create a healthy environment for you and your kids to more easily transition back into normal life. So I'm going to turn it over now to Nicole Young, who is going to start us off on healthy relationships.
Thank you, Dr. Francis. And I loved your reminder that, adversity is not destiny. And I borrowed this graphic from one of the ACEs Aware learning sessions we had recently, because it was such a good reminder that even in the midst of a lot of heavy trauma and stress and challenges, there's hope. That when we think about some of the negative effects that can happen from adversity that Dr. Francis was talking about, we can also think about how to balance that out, how to tip the scale towards those positive supports, more resilience. And just like there have been studies about the effects of adverse childhood experiences, there's more and more research coming out about the effects of positive childhood experiences. And so it sounds really obvious, but it's actually very reassuring to see more of this being published as science. Like the things that we know in our hearts is actually coming out in science. And so we think of positive childhood experiences as getting to experience positive parenting, those warm, nurturing, caring relationships with parents and caregivers. And when kids feel that they can express their feelings openly and they have supportive family members and friends, a variety of activities in the community to be part of, it creates that sense of belonging. And especially when there are other caring, trusted adults that kids can turn to, and they have safe schools. Those are all the things that add up and add up in our favor, that help, again, tip that scale and help counteract or even kind of cure some of those effects of stress and trauma. And so a few tips, and I forgot to introduce myself. Sorry about that, Nicole Lezen. I'm here as the Triple P coordinator for First 5 Santa Cruz County. So Triple P is the positive parenting program. It's available countywide in English and Spanish for families in Santa Cruz County. And so one of the things I love about Triple P is just how simple but very effective some of these strategies are. And for me, I found myself, even though my kids are 17 and 21, and you would think that I might not need positive parenting tips anymore, I found myself having to remind myself to go back to the basics, like be available to talk when they're ready, to not push them or, force them to sit down and have a heavy discussion, but just to let them know that I was there to talk, there to listen. And then when they did share something, and when your kids share something, be ready to listen to their hopes, their fears, their wonders, their worries, and just to take it all in and acknowledge it all as real and valid, because that's what it is to them, even if it feels, blown out of proportion or unrealistic to you. Just, letting them know that you're listening and that you are hearing what what they're saying goes a long way. And then you can help them plan for what they might want to do in situations where they feel stressed or worried or anxious about, starting to play with friends again, or going back into social situations with a lot of people, or whatever it might be that they're wondering and worrying about. That as a parent or caregiver, help them think through, well, what do you think you could do? What might you try or say or do? And then practice. So in Triple P, one of the things we often do is role play with parents, so that they actually are building that kind of muscle memory about how they'll coach and teach their kids. So do the same thing with kids. It works really well because it builds those problem solving skills. If you're like me and you let some of those family rules get kind of relaxed, maybe non-existent during COVID, this is a good time to just gradually start reestablishing and reintroducing those family rules. Keep it simple, practical. Remember to have realistic expectations, not only of yourself as a parent or caregiver, but of your kids. And give yourself time, give them time. Just, change doesn't happen overnight. Sometimes a lot of change at once is what adds to the stress for everybody. So give it time, give yourself time and space, and then celebrate those small successes. Sometimes it might just be, did the cat get fed today? Did you take a shower and brush your teeth? Even for adults, those can be those small wins that we have to celebrate. And then you just, gradually kind of get back to that sense of, normal, or what used to feel like a regular routine. So those are my tips from Triple P, and I will pass it on to the next person.
Hi, my name is Raylene Walker. I'm also a pediatrician here in Santa Cruz. Another role I have is that I'm very involved with the American Academy of Pediatrics, which is an organization dedicated to the health and well-being of all children. I am currently president for our Northern California group, although my term is ending soon. So sleep is super important. Everything is better when we are well rested. Literally, we are healthier when we get good sleep. We are smarter and we learn better, and we are also much happier. So healthier people who are getting adequate sleep are sick less often. They heal faster and better. They're less likely to be overweight. They're less likely to, as adolescents or adults, use alcohol or other substances. There are fewer car accidents and other kinds of accidents. In fact, people who get adequate rest live longer. There is literally, data on how our lifespan is affected. Kids who are well rested and people who are well rested do better in school. They learn better. They perform better on tests. They get better report cards. They have higher IQ scores. They have better focus. And they're happier. If any of us are tired, we are less likely to handle frustrations well, and it exacerbates everything. So anxiety, depression are worsened when we are tired. If we are tired, we also may not have the energy to do some of the work and the other things that we need to do to try to improve our anxiety or depression. There are higher quality of life scores, and one that I know we all have experienced directly in our lives, people who are well rested are much more pleasant to be around. Next slide. So how much sleep do people need? So there is in the past 15 to 20 years, kids on average are getting about an hour less of sleep per night. This is related to screens. Most likely, not always. I mean, there are some, I'm generalizing a little bit there. So this is just some guidelines of how much sleep people actually need, kids need at different ages. It is a lot, and kids often do not get adequate sleep. So if we can even boost it up a little bit, this is going to be very helpful. Next slide. So how do we do that? So so the way I frame lots of things in my own head is that we can improve our skills with practice. We improve everything with practice. And so sleep is something we can actually improve. So we want to have
Entonces el dormir es algo que se puede mejorar.
I don't know if that was supposed to pop up in that window. So we having a consistent bedtime and a narrow wake up time window. So roughly about an hour, give or take, but not, going to bed much, much, much earlier on weeknights and then staying up really late on weekends. Consistent bedtime routine that's fairly narrow. So 30 minutes for younger kind of school age kids. A classic one that works really well is bath, book, bed. Having a relaxing and soothing activity before bed. So we don't want to have the kids getting all revved up and jumping around and being crazy people. So again, that's where kind of that book is an excellent way. Having a good sleep environment, being in our beds, having kids be in their beds, having the room be dark. A nightlight is fine, but generally, we sleep better without additional light. And in a cool room. Last week with the excessive heat, that was a little challenging. We sleep better also when we are physically tired. If our bodies are physically tired, we are much more likely to be able to rest. So getting some vigorous exercise early in the day, at least 2 hours before trying to sleep. Avoiding the screens 2 hours before sleep. Avoiding caffeine. Caffeine for kids is most likely going to be soda or energy drinks, though rather surprising number of kids do drink coffee. Sunlight exposure can help us with our circadian rhythm. So getting sunlight exposure in the morning, sitting outside for breakfast, sitting on the porch, getting out of the child's room. Lastly, consulting your medical provider if you have concerns for sleep disorders. So things like excessive snoring, which can represent obstructive sleep apnea, or problems with restless legs, severe allergies, anything. So if you have concerns about that, there are things that we would be able to help you with. Thank you so much. And again, thank you for joining us and taking your time this evening. Bye-bye.
Hi, I'm Dr. Alexis Teplick. I am also a pediatrician here in Santa Cruz and just wanted to talk to our group out there about nutrition. So many of us have had the experience or know someone well who felt that their eating wasn't exactly as they wanted it throughout this pandemic and have had some weight gain they were uncomfortable with, because their exercise routines were disrupted because of the easy accessibility of snacks and food in the house, because anxiety and stress lead many people to snack more than they might have or differently than they might have. On the other side, we also saw countrywide a huge increase in the number of restrictive eating disorders at every level of care. We saw so many more people who were regulating their emotions, perhaps, with food by limiting it. And these people often, unfortunately, even experience more anxiety as the restriction leads their body to understand itself to be weaker and then has to scan for threats. So a hyper awareness develops in people who are overly restrictive. So it went bad in either direction. Lots of people have struggled. My first piece of advice, if any of this applies to you, and actually really for all of us, is just to be gentle. Gentle with yourself, gentle with your family members. Society is rife with these sayings or things that we tell each other about, I was bad today because I ate cake, or I was good because I had a carrot, or I'm undisciplined because I snacked more than I intended to. If we think about it, I think we all recognize in our hearts that our human value isn't based on what we consume as food. That is not who we are as people. And the more we can help ourselves grow away from those judgments, I think the better our relationships with food can be. So another part of that can be excessive focus on the details. A lot of people do like to weigh and measure and account for calories, but it can be hard on people sort of at either end of the spectrum, or even at most points in the spectrum. For someone who has a restriction or restrictive eating disorder, it's pretty obvious why that can be triggering, watching every calorie, finding the lowest calorie foods available, counting them all day long. That stuff's pretty obvious to us. What seems to be less obvious is that if you are trying to deal with unwanted weight gain or new food patterns that you're uncomfortable with, sometimes spending your day thinking about food means you spend your day thinking about food. And so you can become much hungrier, as people often are when they're faced with advertisements or even pictures of food. So spending our lives thinking about what we're eating often leads us in a direction that we're not trying to go. So my recommendation in this setting, and I think everyone would agree, is hit the minimums. You want to make sure you're getting what you need, and that should be your primary focus. So obviously, fruits and vegetables as much as possible, as much variety as possible. And I think everyone around here is pretty familiar with that recommendation. Healthy fats like avocados and nuts and salmon are good both for the body and also for the brain and emotional regulation. And while there are definitely people who enjoy or feel better on something like a keto diet, for a lot of us, whole grains help us feel better, help regulate our hunger, help us feel better emotionally and physically. And I think it's important to leave room for fun and celebrations, eating with your family, your community, within reason, given the situation we're in with the pandemic, or eating a slice of cake at a party, or a Hershey's Kiss because you feel like it. Those are all potentially versions of healthy eating. My perspective on that I'd like to share is that joy and community and freedom from thinking about every bite that goes in your mouth, that is healthy eating. So if you find that you're struggling in any direction, you're worried perhaps that you're restricting foods in a way that isn't healthy, or maybe you're tying your exercise to calorie counts, or even some people, you know, it's fairly common who find themselves making a habit of vomiting after meals. All of these things you can talk to your doctor about. And, you know, we are here to listen and to help guide you in whatever way might be necessary. But generally speaking, be good to yourselves, be kind, eat good basic things, and don't worry too much about the extras from time to time. Thanks.
Thanks, Alexis. I'm Dr. Cal Gordon. I'm a pediatrician also with public health, and I have the opportunity to talk about exercise today. Can you remember yourself as a child? Do you see yourself running or playing outside? Well, the thing is, these days, and certainly during the pandemic, kids spend more of their time in front of a TV or computer rather than playing sports or being physically active, and that is not good for the health. Statistics show that more than a third of children are overweight or obese, and as overweight children grow older, they can face obesity-related conditions like heart problems, high blood pressure, diabetes, and high cholesterol. This can also affect their self-esteem and shorten their lives. Did you know that kids need 60 minutes of physical activity every day? Kids were meant to move and play. How can you help your kids get moving for at least 1 hour every day and make sure that their hearts beat faster, they breathe harder, and that they sweat? Well, look for ways to make exercise fun. Find out what your kids like to do and take their lead. Make it fun. Chase your children around the park, bike and walk as a family, help your kids use their imaginations, celebrate like you kicked the winning goal. Ask your family and friends to take turns doing activities with the kids. Certainly in Santa Cruz County, we really don't have any excuse to get outdoors. We have so many opportunities at the beach, community centers, parks, and open spaces to swim, play, hike, and run. At a young age, make sure that your children have the opportunity to play, especially outside. And as your children grow older, let them try different physical activities or sports to see which activities are most fun for them. They are likely to find one or several activities that are likely to last them a lifetime. Exercise is good medicine. Exercise helps keep children maintain a healthy weight and grow strong. It keeps them feeling good about their bodies and reduces stress. Children who exercise even do better at school. Kids who are physically active sleep better, and they're better at dealing with life's challenges. They are less likely to develop chronic diseases like type 2 diabetes. For all these reasons, it's extremely important that kids are physically active every day. Thank you very much.
Good evening. I'm Dr. Satu Larson. I'm a pediatric nurse practitioner and pediatric complex care manager at Santa Cruz Community Health. And I'm so pleased with everyone here this evening. We are here together as a community as we have been through so much, and we still have a long way to go, but we want to do it together and want to support one another. And I was able to speak about mental health, but as you can see, all the prior slides have already been addressing our mental health, because physical, mental, and spiritual health all coincide together and are mixed together. And so I wanted to reiterate what Dr. Francis had mentioned, is that, you know, this shelter in place has been a form of trauma for everyone, not just the children, families, everyone in our communities. And I really like to name that so that we can understand why, when maybe our child is having a tantrum out of nowhere, or why our child refuses to go outside to the park, or why our child now is obsessing over food. And it's just really important to recognize that we're not sure how it's going to manifest in these next couple of months as we slowly come back all together. Will it be nightmares? Will it be tummy aches? Will it be refusing to see friends? Will it be binging on some whatever form of social media you're on all night long? And so I wanted to just really reiterate that the lack of physical interaction The exposure to media, and of course, the prior 4 years were quite horrific. And the lack of protective services for youth has really led to a lot of increased rates of anxiety, depression, and suicidality in youth. So please be aware, friends, family, teachers, leaders in our community, medical providers, whoever you are, that remembering kids, it can be challenging to see anxiety and depression. Often depression in a 4-year-old might be aggressive behavior. It could be irritability. Mood swings can go either way, but there can be changes in sleep and appetite, difficulty focusing, loss of interest, fatigue, hopelessness, feeling worthless. And that's really important because you have to feel worthy of health. So to engage in any of these activities, you have to also feel that you're worth health to get to those, and then start these routines, start working on sleep and your food intake. So and then feeling trapped, and to break through that and get out and run around, so risk taking, especially in adolescence, headaches, stomach issues, because it can be constipation, it could be pain, or any sort of pain really can manifest from actual medical reasons, but often it can be signs of any sort of behavioral health concerns such as anxiety and depression, using substances to self-treat your pain and what you're feeling, or just refusing to go to school. Next slide. And so if you have, these are hard conversations to have because you may see a family member struggling with any of those. So to be mindful and gentle during this whole process, parents, children, it's been really rough. We've had a tough time. Maybe we've done things that we're not so proud of, but that's okay. We're not going to judge. We're just going to name it, be mindful, and move on and get help. So if you can reach out to your primary care provider, or if you have access to a behavioral health provider for evaluation and support, or if you want to just begin browsing the internet, Triple P has fantastic programs. Center for Mind Body Medicine, we're going to discuss next, and we're going to be offering to the community. Now, I chose just one book. There are hundreds of books, and we will compile a book that are available at our libraries. But I really like Dr. Chansky's books for anxiety and negative thoughts. And then also, if you need 24-hour crisis support, maybe you're not yet ready to hear these things, or are in that spot where you think something's wrong, but then you find yourself in crisis mode. So please keep these numbers on your phone, nearby in the house: Suicide Prevention Hotline, the Trevor Project LGBTQ line, Walnut Avenue, and Monarch Services, because we never know when that moment comes when we finally realize we need that help. And we just want to remind you, the Pediatric Health Work Group, we are here to support you. We want to support the community, and we're very grateful for having this conversation because we want to heal together.
Thank you, Satu. My name is Jen Hastings, Dr. Hastings. I'm a family doctor. Buenas noches. I would like to bring us to a moment of connection with ourselves. And I apologize. I hope my sound is okay. I just saw it's unstable. Oh dear. So I would, if you've been sitting down, I'd love for you to just stand up for a moment and just do a little shaking. We've been on this thing for a half hour, so let's just do a little shaking. Get that energy out. And then bring yourself, after that shaking, into a place of standing where you can really feel your feet on the floor and feel that you're connected to the earth. We're going to have a moment of just taking the energy up from the earth and bringing up it into our legs. Maybe put your hand on I'll move the camera, put your hand on your belly, put your hand on your heart. Just feel yourself, feel your body, and take a nice big breath. And I'm going to encourage you to, with the next breath, lift your arms up over your head. Dr. Cal Gordon was talking about movement, and we can actually, in the middle of a work day when we've been working, take a nice deep breath. Inhale, bring your hands over your head, maybe cross. I'm going to lower down, cross your arms up there. do a little stretching up to the tippy toes, come up on your toes, and then come down. Spread your fingers out like wings. Come up again and down. Take a nice deep breath. We're going to have an opportunity as a community to do some mind-body connection together with something called the Center for the Mind-Body Medicine. And there are lots of ways that you can connect with yourself. And we're going to have 2 hours together. This is, we've raised money together as a community to offer this to teachers, community members, families. So anyone on this call, or if you've been part of the ACEs call, we welcome you. Everyone in the community, grandparents, parents, aunts and uncles, los tíos, toda la familia, to come and join us for 2 hours on Thursday, August 5th. We'll put the registration in the link, and when we send you these materials by email, you'll be able to just push the button and join us. We have a lot of wonderful tools together to connect both to ourselves and to our community. People mentioned trauma today, and sometimes with trauma, it's scary to connect and feel what we're feeling. And the pathway to healing that trauma is actually to come back into connection with our body and our mind and our heart and our breath. And so that'll be a journey that we'll get to do together. I hope you'll join us. And if you're not able to join on that date, we'll be hopefully starting a series of groups that you can join, even if you're not free that day. I think I've probably used up my 2 minutes, so I'll pass the baton to the next person. Thanks so much.
Good evening. This is Anna Sutton. I am a nurse. I'm a public health nurse, and I work for the public health department here in Santa Cruz County, and I serve as the director of nursing. And I'm going to take the next couple of minutes along with my colleague, Michelle Mazeras, who will introduce herself, to talk to you a little bit about vaccines here in Santa Cruz County. And the first thing I want to do is tell you that I'm also a mom. I'm a former school nurse, and I have 2 teenagers who have gotten vaccinated. And I want to share that vaccination is preventative medicine. And here in the US, being able to access high quality preventive medicine is such a gift that parents can give to themselves and to their parents and to their children. So I just want to start off by saying that. And then I also want to share some thoughts with you about COVID vaccine that I'm really going to borrow from Dr. Walker, who presented earlier, and that is about the safety of vaccines. So COVID vaccines right now are approved for ages 12 years and up. So those are your middle schoolers, all the way up through high school, and are all of our adults. Right now, over 8 million children ages 12 to 17 in the US have received at least one COVID vaccine. And really, vaccines are our greatest tools to protect you and your community, especially as we get back to going to full-time in-person school and living life with COVID-19. A special message for our parents and our guardians. After you are vaccinated, you actually can feel more comfortable getting together with your family members and then not feeling like you might be worried about accidentally infecting someone that you love. If your child is vaccinated, you're going to feel a whole lot more comfortable with them going to school. And all of our vaccines, all of the brands, including the ones for children, have shown to be very safe and to be very effective. Right now, there are studies ongoing to test other vaccines for the kiddos who are under 12 years of age. And anyone who's eligible right now, I encourage you, and all of us on this call, to encourage you to get it. The other thing too is we want to highlight that we know you as parents may also be expecting a baby. You may be planning for a pregnancy, or you may be someone who is breastfeeding or lactating, and that vaccine is very safe for you to get as well. And we want you to get that vaccine. So vaccines are really the best tool that we have right now to protect our entire community, especially because, as we mentioned, we're not quite there yet. We are out of the thick of it, but we're not quite there yet. And we do have the threat of variants. So to be vigilant about that. And so the final thing I'm going to share before I hand it over to Michelle is, on this slide, you're going to see some numbers. And I want you guys to remember these numbers, that in Santa Cruz, in general, our whole population, we have done fantastic with vaccinating our general population, but we have some work to do with our teenagers. And I get it, I have 2 of my own, but just to remember that right now with our data here in Public Health Santa Cruz, 2 out of 3 teenagers who are eligible for vaccine ages 12 to 19 have not been vaccinated yet. So we have some work to do this summer, but we've also got time to do it. So thanks for your time, and I'm going to hand it over to Michelle.
Hello, everyone. My name is Michelle, and I am a public health nurse as well, and I'm the immunization coordinator for Santa Cruz County. I'm here to give you some ideas on how you can protect yourselves, your family, and our community by getting vaccinated. Teens, you can start by empowering yourselves with education. Get to know what vaccines do and how they work. Then you can get vaccinated. Start this process by discussing vaccine with your parents and guardians. Then you can invite a friend to come and get vaccinated with you, someone who's going to be there and hold your hand through the process and whose hand you can hold in return as they get their vaccines. Parents and guardians, you can start this process by contacting your primary care physician, your child's primary care physician. Pandemic really impacted routine vaccines across the country. See if your child is behind on their vaccines. Next, make a plan to vaccinate and celebrate. Make your vaccine appointment now. Schools are starting soon, just around the corner, some in Santa Cruz County as early as August 11th. Start that process now, don't wait. And then finally, I encourage everybody to use the Santa Cruz County website as a one-stop vaccine resource. I look forward to helping answer any questions that might be out there, and I will turn it over to Dr. Francis, I believe, for some fun summertime activities.
Okay, yes, Dr. Francis, I'm back. So we've heard our stress busting tips, heard about vaccines. So what are your kids actually going to do? I think this is really going to look different for each family. Each kid is different. Kids are at different ages, different family experiences, different things. So everyone's going to have a different summer. But what I encourage families to do is to think about what's most important to your family. When you kind of decide what are you going to be spending your time in, what are you going to be investing your resources in, and what's most important for your family and for your kids. Some general tips that I think we can all kids, I think, should be doing at least some of these tips, no matter what the rest of our summer looks like. Number one is unplug from screens. Most kids spent way too much time on screens this year, and they were a really important way to keep us connected with school, keep us connected with friends, family that we couldn't see. They even helped some of us parents who are working remotely, having our kids on screen helped us in that aspect as well. So they were helpful. And now it's time to let it go, take a break, and unplug. Playing outside. This has already been mentioned by Dr. Gordon, but this is really just a classic summer activity. We live in this beautiful area, so beach, park, mountains, or any local space around, your own home where you live, just get outside, hike, bike, explore, depending on your kid's age. If they're young, even just playing outside on the porch with a bucket of water and some cups is fun. If they're older kids, they may want, more structured activities, but getting outside. If you are going to get together with friends or family outside your household, being outdoors is always going to be safer from a COVID prevention standpoint. COVID is much less likely to be transmitted when we're outdoors. So outdoors is safest. If you're getting indoors or if you're not yet vaccinated, masks are still going to be important. And as always, throughout this whole pandemic, washing your hands often and staying home if you or your family member is ill. Those things are habits that we have picked up during COVID, and those are ones that we should carry with us. Reading. I always encourage all my patients and my kids to read every summer. It's so important, but I think that this summer it's even more important. Pretty much every child had a very unusual school year this last year. And most kids probably did not learn as much as they normally would have. So reading every day through the summer, I think will help with some of that learning loss. And, the local libraries are doing their summer reading programs. So encourage your kids to do some reading every day. There's also summer school. Forgot to add it to this slide, but summer school is also really important for kind of trying to combat that learning loss that kids may have had, or just to provide more opportunity to socialize, to kind of dip your toe back into getting together with other kids. Summer schools also are great options. You can check with your school what's available. And finally, there's camps. So many camps are opening up, and these are also really great ways for kids to socialize, to be in a group, to learn together, to separate from their caregivers in the home, just to get out of the house a little bit. It can be a nice bridge or, small transition as we think about going back into in-person school in the fall. There's a whole bunch of camps out there. We can send out some links of, different camps in Santa Cruz County. Again, what works well for different families, it might look very different. I think there's something out there for everyone. There are guidelines for camps. We can also send out in our resources. There's CDC, the Center for Disease Control and Prevention, has guidelines for summer camps for kids, and we can send them out. It's a short list of things that you as a parent or caregiver could look at when you're evaluating camp to see that if it looks like it will be a safe place to send your kids. But camps can be a really great place for kids to kind of ease back into normal life and have a great time as well. We're going to the next slide, and we're going to move from summer into what our school is going to look like.
Thank you so much, Dr. Francis. My name is Farah Sabah, and I'm the County Superintendent of Schools, and I have the pleasure of working with all of these wonderful advocates for our community, our youth, our children. And, one of the things that we've learned through this pandemic is the important role that schools play for students and their families. Schools represent such an important place for families to get information, to get, of course, children to get their educational services, but also services like food, counseling services, and other kinds of supports. And so we recognize how disruptive the pandemic has been and impacting students and families in a variety of ways. And we also were reminded about how unique each of our students is and how their way of experiencing and adapting and struggling with the pandemic was different for each of our students. And I think we recognize that we need to customize our services and our programs and our education to meet the needs of our students. We are committed to opening our schools full-time in person in August for all our students. Every single school in the county is committed to that. And we want to ask you to talk to your child, talk to if you're feeling like there are concerns about social anxiety or depression, to not only work with your pediatrician, but also with your school personnel, talking to your teachers, administrators, counselors, if you have any concerns. Make sure, as you heard earlier, to be up to date on your immunizations, so there's no problem with registering your children for school. And we encourage you, of course, to get your child vaccinated if they're in the right age group, 12 and up right now, and hopefully we'll be able to vaccinate more students for COVID-19 as FDA approves more vaccination ranges. Schools are investing heavily in mental health services right now and into the fall. We're hiring more counselors. We're working because we recognize that we want to provide those support services to students. And so it's important for you to find out from your school what kinds of services are available for your kids, for your children, to be able to ensure that they take advantage of the services that are available to them. And because we want them to be successful in school, not only academically, but also because we care about their well-being. We are following the guidance that we're getting from the California Department of Public Health because we're required to follow that guidance and from our local public health offices. At this point, the California Department of Public Health is requiring that all people in schools indoors wear face coverings. And we are expecting that new guidance is going to be coming to us. And we're staying up to date to make sure that all our schools and all our families are going to be notified if any changes are going to be taking place. but we want to make sure that our schools are continue to be safe, that we're protecting everybody from any possible surges of COVID-19 in the future, and that we are able to provide the most supportive environment for our students, and that not only for our students, but also our families. And so we are so grateful that you're a part of our conversation today. And I think that we are gonna move on to our next slide, which is we're gonna open it up for questions. Thank you so much.
Thanks, Dr. Sabah, and all of our panelists for sharing all these great tips and information. We know we put a lot in front of you. Some questions are showing up in the Q&A, and we've been answering them in real time. So if you want to find your way over to that by clicking on the Q&A button on Zoom, you'll see ones that are open or answered. You can offer one, and we have some that were submitted ahead of time. So we'll just run through a few of these that we've been receiving, and please keep them coming because we do have a few more minutes together. And I just want to congratulate all the panelists on being perfectly on time, which is really great for your facilitator. So thanks to everyone. So let's see, one of the questions we have here is about attending community meetings without masks. And so I think Dr. Walker was tackling that one. Do you want to share that one with the group?
Sure. So that wasn't me specifically, but I'm happy to talk about that. So there are right now still a mix of people who are vaccinated and unvaccinated. And by definition, kids under 12, none of them are vaccinated. There are also immunocompromised people in our community who do not, and they are unable physically to respond, their bodies are unable to completely respond to vaccines. And so they may not have protective antibodies at the level that they need. So a community meeting, anything indoor, we would recommend still wearing a mask. An outdoor meeting, the guidelines have changed a lot, but at this point, if you're in a group that is all vaccinated, which I think would be, it depends on the meeting. It depends on who you're with. In a, medical setting, I, have had a couple of meetings with coworkers who we know that we are all vaccinated, and we have chosen to meet outside, and we have taken off our masks, and it feels really nice. So I hope that did that answer the question adequately?
Oh, yes, thanks. We know there's a lot of concern about the Delta variant circulating in California and around the country. And so we had a question about the protection of children from that variant in the context of these different categories of people who are eligible for the vaccine or maybe unvaccinated or partially vaccinated. And so we've got a couple answers here about the effectiveness of the mRNA vaccines, the messenger RNA vaccines, and surrounding people who can't be vaccinated, like the younger children yet, surrounding them with people who are vaccinated and protected to not give those variants anywhere to go. But I wondered if any one of our panelists wanted to add anything reassuring about that or things to be on the lookout for regarding the variants.
Well, I think it'd be useful for folks to know that this is something that our county and our state, is being monitored very closely. And if and when there is a variant that is not covered well by our current mRNA vaccines or just our current vaccines period, there is going to be rapid action to attempt to improve a new vaccine, a booster perhaps. So the Delta vaccine right now, is present in the Bay Area. It is, present probably, in increasing numbers locally, but if we can, so it's kind of a numbers game. If we can get above, herd immunity and stop spread from person to person, again, like Nicole said, it won't really have anywhere to go. So being looked at super carefully, lots of studies going on about how long antibody protection lasts, so that the question of when or if people would need a booster will know that. And more, we'll have more information as time goes on.
Okay, thank you, Dr. Walker. Let's see, we have some other questions here. We have some that were answered by the presentation. So Dr. Sabah, we had questions about returning to school that I believe you answered both in the Q&A and during your presentation. And so again, with more people being vaccinated, more teens being vaccinated, those increase our chances of returning to school in person and having schools stay open. So really important for looking ahead as well. There were questions about any new information about vaccines for the younger children. And we had a response that the Pfizer emergency use authorization, that approval is expected this fall. And of course, everyone is very eager for that to happen. And so that will be something that probably will follow in quick succession. So we'll keep tuned for that. Are there other questions that people want to add? Dr. Gordon, did you have anything to add about the
I just wanted to mention a bit about the Pfizer for emergency authorization that will be from ages 5 to 12. And so under 5 is not likely to be presented. In terms of the variants, we do have fairly active surveillance. To date, we have not identified the Delta variant, but I think it's likely just to be a matter of time. The Delta variant is becoming more and more dominant in terms of its presentation and nationally and also in California. So I think we are at risk, although again, there's good protection, in particular with the messenger RNA vaccines.
Great, thanks for that. So I also wanted to give, I think we rushed through our public health nursing just a tad, but I just wanted to emphasize, in addition to the COVID vaccines especially for the younger cohorts in our county, the pitch from Anna and Michelle for parents to make sure that the routine immunizations are still happening, because we've had some drop-offs there as well. And so it's really important to keep that ongoing health aspect of kids' lives and returning to school going as well. So Anna and Michelle, I didn't know if you had anything more specific you wanted to share on the childhood immunizations.
I could just jump in really quickly and say that that in California, there's evidence that the MMR, which is measles, mumps, and rubella vaccine for those that are under the age of 3 and children that are between 4 and 6 years old, which is, entry into school time, those rates were down significantly from 2019 to 2020. And then also for Tdap, which is required for going into when you're a 7th grader, you need that Tdap vaccine booster. So those rates were down as well. So just, really after, spending a vast majority of school the past, couple of years or year and a half or whatever, at home, just making sure that your children are caught up on those vaccines so that they are able to start that in-person learning that's so important. So.
Okay. And we did have another question in the Q&A about risks that non-vaccinated people who are pregnant may face. And I think we had talked about this a little bit, but I wanted to give any of you a chance to address that.
I can take that one.
Thank you, Dr. Francis.
If you're pregnant, COVID-19 is, you're at higher risk for more complications from COVID-19. So if you're not vaccinated and pregnant, that would certainly be a risk for, potentially getting COVID vaccine. And, one piece about this variant that's different from some of the other strains that we've seen is that it's more contagious, meaning it's easier to pass. And so as we're getting more and more people vaccinated, the people who are not vaccinated which are mainly young kids and then adults who haven't been vaccinated yet, those are the people that are more likely to be getting this more contagious variant. So that would be the risk for someone who is pregnant, is to potentially be infected more severely with COVID-19 and, potentially this variant. So, COVID vaccines in pregnant women, there's been at least over 40 studies that have looked at pregnancy and breastfeeding with COVID vaccine, and they really do appear to be very safe and very effective. So I think it would be really important for all pregnant women and all breastfeeding women to be getting that vaccine, this summer as soon as possible.
Okay, thank you, Dr. Francis. Well, it looks like we're right at the end of our hour. I want to thank all of you who took the time out of your evening to join us. And I want to thank all of the members of the Pediatric Health Work Group for taking the time, not just to be here tonight, but to be together every week, considering these kinds of questions and how best to answer them for our community. We so appreciate all of you and the opportunity to work with you. And thanks to the HIP staff who make all of this look good and make it easy for those of us who are trying to organize it. So thank you so much. And we will see you next time. And we will send the materials, any other questions and answers that we've compiled, and links to the resources that were mentioned in the slides, so that you'll have access to those if you want to share those with family and friends. But thank you and happy summer. Stay safe and well.